Hello and welcome everyone to the Thermographic Diagnostic Imaging Health Through Awareness August 2017 webinar. My name is Leisha and I will be your host. For this evening's webinar, you should be able to hear me as well as our speaker and to follow along with her PowerPoint presentation. If for some reason you get cut off, you can try logging back in and catching up, but don't worry, the webinar will be archived on our website in a day or two and it will be available via YouTube. If you have a question, please submit it, and we will get to as many questions at the end of the presentation. So it's my pleasure to introduce Christina Veselak tonight, a licensed marriage and family therapist. She's trained as a nutritionist in 1993 and specializes in nutrition for emotional well-being and addiction recovery. She has a private practice as a psychotherapist and mental health nutritionist through her clinic Garden Gate Counseling and Consulting in Denver, Colorado. Christina is also program director of St. Ephraim's Center, a nutritionally informed addiction and mental health counseling program in the Eastern Orthodox Church, and is a founding member and former executive director of the Alliance for Addiction Solutions. As a principal trainer for the Alliance, she speaks and teaches nationally on nutritional approaches to mental health and addiction treatment. She also runs and teaches 2 online certification programs in biochemical and nutritional approaches to mental health and addiction recovery through her company, the Academy for Addiction and Mental Health Nutrition. In addition, she consults with treatment programs, helping them integrate crucial nutritional elements into their program. So welcome, Christina. Thank you so much for being with us tonight. I'm very excited about the information you're about to share. I think it's so important.
Well, Leisha, you're very welcome, and thank you for having me. I'm so excited about this information because I believe it's life-changing. And what a lot of people don't realize is that the information I'm going to share this evening has actually been known and taught and written about since the mid-1950s. But unfortunately, it has not caught on in modern psychiatry or addiction treatment. So it really is cutting edge information, even though it's been around for a long time.
Yeah.
So I want to talk tonight about building emotional stability with amino acid therapy. Before I start, I'd like everybody to understand that even though I'm focusing on amino acids tonight, they don't work by themselves in a vacuum. And for full utilization of amino acids, we also need to have all the mineral and vitamin cofactors in place and enough of the omega-3 fatty acids, etc. So I just want everybody to understand that this does not operate in a vacuum, but that amino acids, which I'll be explaining what they are in a minute, work synergistically with other nutrients. So we are all aware that our feelings and our behavior and our moods and our impulses are sometimes very much in balance and make total sense to us, and are sometimes very much out of balance and don't make a whole lot of sense. PMS is a very good example of this. But what I'd like to start with is the concept that all of our feelings, our moods, sleep, our choices, and our ability to make choice, our ability to have willpower and perceptions, our behaviors, everything is mediated through the brain. And very specifically through a set of chemical systems called neurotransmitters and neurotransmitter systems. For us and our lives to be in balance, our brain must be in balance. That means we must have balanced blood sugar, we must have balanced hormones, but most importantly, we must have balanced neurotransmitters. So what are neurotransmitters? Well, neurotransmitters are, let me go ahead here, are little chemicals that the brain makes out of amino acids, and amino acids come from the protein we eat. And these neurotransmitters are stored at the end of each neuron. When needed, the neuron then releases it into the synapse. As you can see here, this little space between the two neurons, the neurotransmitters are the little green balls, and they get picked up at the beginning, as it were, of the next neuron in little receptor sites. And this chemical signal that travels down the neuron and across neurons and through the entire brain are what mediate our feelings, our moods, our perceptions, our behavior, our energy, all the sort of active personality parts and consciousness and aliveness parts of our being. So if the neurotransmitters are in balance, we're in balance. But if the neurotransmitters are low, we feel out of balance. And we're going to have psychological symptoms such as depression, anxiety, fatigue, anger, irritability, tenseness, insomnia, etc. And most of us do not like those feelings. And so most of us are going to look for something to make ourselves feel better. This can be as simple as turning on a TV set, going for a walk, talking with a friend. The walk and the friend are some of the healthier ways of getting our neurotransmitters in balance, right? Taking a hot bath, going for a run, eating something healthy. Okay, these will all help raise and balance our neurotransmitters. But many of us turn to not so healthy things such as candy and alcohol and marijuana and cocaine and gambling in order to try to bring our neurotransmitters back into balance, fire those feel-good chemicals, and feel okay again. And that's when we get into trouble. Because what happens when we use a strong mood altering chemical, such as alcohol or cocaine or tobacco, rather than something like eating a good meal, getting a hug from a friend, or going for a run, one run rather than 10 runs, we may fire these neurotransmitters temporarily, but then we also deplete them. And this is the neurotransmitter theory of addiction. Our neurotransmitters may start out depleted because of genetic issues, or we may deplete them through illness, through poor nutrition, or through stress. But the more depleted our neurotransmitters are, the more stressful our emotions are, and the stronger is our inability to deal with stress gracefully. So I really believe that it's our brain's job to allow us to cope with stress gracefully. But to do that, it needs to be fed optimally. When it's not fed optimally, then we are very often drawn to the use of mood-altering chemicals and behaviors to feel better. They further deplete neurotransmitters, leading to tolerance and increased use. We all know that after a while, one cup of coffee or one cigarette is not enough, and we need more and more and more to get the same effect. But the result of this is that if you stop using, whether it be cigarettes and coffee or something more serious such as cocaine, marijuana, and yes, marijuana is addictive, even though very many people want to think that it's not, or drugs like benzodiazepines, then we have withdrawal symptoms, something known as post-acute withdrawal, and cravings. These are all due to very depleted neurotransmitters. Now, conventional medicine and conventional addiction treatment addresses this using more medication. We think that that is tragic because we can very easily rebuild our neurotransmitters using amino acids. and other nutrients very quickly and without drugs.
Mm.
This leads to reduced cravings and improved mood. So this information does not just apply to people who have issues with mood-altering chemicals. This also applies to sort of the rest of us who are just anxious and stressed or have insomnia or depressed. And we don't use any of these harsher chemicals, but we still want and need to feel better. And unfortunately, the only toolbox that modern psychiatry has is medication that tweaks the brain. It doesn't feed the brain.
Mm.
I believe in feeding the brain first.
It just makes sense.
Well, it really does.
Yeah.
And this is what I would like all of your listeners to really understand, that we have alternatives to psychotropic medication.
So important. And when you were giving your opening, Christina, and you said that treatment centers aren't using this method and people don't know about it, of course I wanted to, ask you why, but maybe you'll be coming to that. I don't want to get off on a tangent, but I mean, it makes me feel so, why are people not listening or doing this? What you're already making it so simple and simple to understand that it's very, very, what's happening is criminal. I mean, it's people dying and lives are being ruined. And here is a simple way to fix it. And maybe you'll address that.
Well, I agree with you that it's criminal. I think what happened is at the beginning of the 19th century, nutrition and health and wellness went out of favor. And the American Medical Association took over control. They were very excited by what they were discovering with the advent of antibiotics and other medications. And they really believed that using these medications and these chemicals could solve all the world's problems, both psychiatric problems and medical problems. And they stopped thinking about the necessity of feeding our brains and our bodies the right nutrients.
Right.
Following that, the pharmaceutical companies took control of medical schools, took control of a lot of treatment programs. And so doctors and addiction counselors and psychiatrists and therapists are not taught that there is any option other than medication. I know that when I was in school 30 years ago, but when my colleagues who are graduating from school now tell me the same thing. We were taught that if we believed that the symptoms from our clients were due to anything other than emotional issues or trauma, that our only recourse was to send them to a psychiatrist for medication. That there was no gray area. And I think that that is so tragic because I run across this gray area with my clients every single day.
Right.
It may be that they're drinking, too much Mountain Dew and that's causing their insomnia and their violence. Right. It could be that they're not getting enough protein or it could be PMS. Once we sort of get some of this information, there are things that my clients and I can do to resolve their biochemical symptoms without medication.
Yeah.
And that's what I do in my practice every day. And that, Leisha, is what I teach other clinicians and anybody who's interested in my online courses.
Yes.
So if, I really want to take a little commercial break here.
Right.
If any of your listeners want to learn more about this, my course is starting up again the first week in September, and we have a weekend intensive that's very exciting that's happening in Salt Lake City in November.
Oh, how about that? And I'm going to give you a little plug too. Philip and I took the course, weekend intensive course in Kansas City. I guess that was, a year ago already. And it was an amazing weekend. We learned so much, just to be in a room full of people that we're all speaking the same language, because I'm always talking about this stuff and people think I'm crazy. So it just was wonderful. We learned so much, and I'm going to have to look into the Salt Lake City for maybe a refresher. So I would encourage anybody who's, whether they're struggling with addiction or have a loved one with addiction, it's just this information is just so important. It's life. It is like completely life changing, Christina.
It really is life changing, and it was so delightful meeting you last year.
Well,
you
thank
and Philip.
You.
Yeah.
You too. Thank you.
So I mentioned neurotransmitters and what they are and what they do. So I want to go more in depth with this. We actually have 4 mood-mediating neurotransmitter systems in the brain. There are more, but they manage things other than mood. So the 4 mood-mediating systems are dopamine, which includes norepinephrine and epinephrine. And it has the amino acid precursors of tyrosine and L-phenylalanine. So again, an amino acid precursor is what the brain makes these neurotransmitters out of in the presence of vitamins and minerals. Then there are the endorphins and the enkephalins that actually are made out of a very large number of amino acids. GABA, which is made out of GABA itself, taurine and glycine. And then serotonin, which turns into melatonin, is made out of tryptophan and 5-HTP. So what are these amino acids? Well, amino acids are molecules which form the building blocks of the human body. They're found in food and clumped together to form protein. When we eat protein and digest it, it's broken back down into its component amino acids, which are then absorbed into the bloodstream and go everywhere in the body, accomplishing many diverse tasks. Some of them, of course, get into the blood-brain, cross the blood-brain barrier, and create neurotransmitters in the presence of specific cofactor vitamins and minerals. That's why we're supposed to eat our veggies. Research shows that ingested amino acids cross the blood-brain barrier and create new neurotransmitters in as little as 1 to 20 minutes, depending upon delivery methods. If you dump it under your tongue, it can absorb almost immediately. So let's just stop here for a moment.
Yeah.
We are talking about a non-addictive, mood-altering chemical that can make us feel better within 20 minutes, that you can buy in your local grocery store and vitamin store. Now just think about that.
Yeah.
And the reason why it's non-addictive is because it's food.
Right.
Purified food, but food. These are astonishing tools that we have the use of. And I'm going to be teaching all of you the basics of it tonight. Now, there's an art as well as a science. And so if any of you really seriously want to start using amino acid therapy, there's some useful books out there, but you can also call me. I do telephone and Skype consultations, as well as other trained clinicians around the country and even around the world.
Since you said that, Christina, and I hope I'm not getting ahead, would you recommend that people do seek a professional as yourself before going on an amino acid program to just get everything in its proper place and
Leisha,
for optimal?
Most people, at least in this country, we're do-it-ourselfers.
Yeah.
And I don't want to discourage that. So, for instance, the book by Julia Ross called The Mood Cure is a very fine guide.
Yes, wonderful book.
And so if issues are very simple and they haven't been going on for a very long period of time, I think that most people can very easily and safely use amino acids, providing you're not on medication already. But if you're on medication, or if things are complex or going on for a long time, then it would probably be a whole lot better if people contacted one of the clinicians trained in this approach, just because there can be a few tricky things when there's complexity or medication involved, and you just want to make sure that you are doing what's absolutely best for your body.
Okay.
So the answer to that is yes and no.
Okay. Well, thank you for that clarification. That does make it clear.
Okay. So what are the sources of these precursor amino acids? Well, high protein foods, meat, fish, eggs, milk and milk products, legumes, nuts and seeds, and carefully grown free-form amino acids, which we can buy in the grocery store. The reason we often like going the free-form amino acid route with the other nutrients is to jumpstart the system. Because sometimes we may not have been eating these foods well enough, or we may not be digesting and absorbing them. A lot of us in this country have digestive issues and gut inflammation. And so even if we are eating well enough, many of us are not digesting and absorbing the nutrients. So jump-starting the system using the aminos while we work on digestion and diet is often a really wonderful combination.
Yeah, got to get the gut working properly.
Well, we do. I mean, I was asked to consult with a 14-year-old young man and his father yesterday. This young man's been having issues in school, and we were hoping that maybe some nutritional intervention could make a difference. When I asked him what he ate some other things as well, but his most favorite food was ramen and Chef Boyardee ravioli, which does not have a lot of protein in it, nor a lot of the cofactors.
Right.
His father was scandalized because his father leaves good food in the refrigerator. But because a lot of these canned foods are actually designed to be addictive, this young man who is already impulsive and has impulse control issues, he's just going for the crap food. And as a result, his brain is starving. And so we set a plan, and he agreed with me to try a whole week of eating really healthy.
Oh, wow.
To see if he feels better at the end of the week.
Right.
And hopefully he'll do it. His father's definitely on board, and we'll see what happens. But I run across this. I mean, this young man's 14, but I have 20-year-old clients, 40-year-old clients walk into my office, and very often their diets know better. And then they wonder why they have anxiety and depression and insomnia and become violent. They have starving brains.
Wow.
So what I want to do now is go through each neurotransmitter system a little more slowly and thoroughly and really talk about what they do and how we can support them. So tyrosine is the amino acid that's a precursor to the catecholamines. Their job is to restore and create inner drive, and we can use them to recover from stimulant abuse, whether that be Mountain Dew or coffee or meth and cocaine. So dopamine is the neurotransmitter that creates the spark in life. It's associated with confidence and enthusiasm, ambition, drive, motivation. It gives us focus and the ability to solve problems. And it also is responsible for persistence, determination, and the ability to creatively develop solutions. Very, very important neurotransmitter. When we have enough, we've got alertness and motivation, focus, persistence, enjoyment and joy, and energy. When we don't have enough, it's just the opposite. So I have a problem when psychiatrists or my clients walk in saying, I'm depressed. Psychiatrists talk about depression as if depression was all one thing. It's not. Depression is manifested very differently in different people and has very different causes and very different solutions. Same thing with insomnia, same thing with anxiety. So low catecholamine depression is characterized by this apathetic depression, lack of energy, boredom, don't care about anything, can't move, want to crawl under your bed and stay there. It also includes lack of focus, easily distracted, so attention deficit disorder. And a lot of people with this crave stimulation from substances or thrills, thrill-seeking behavior. These are the people who live on the edge, who love extreme sports, who need to do something in order to feel alive.
For that adrenaline rush that they get?
Precisely. That adrenaline rush is an attempt to offset this chronically low sense of life. Now, people can have a lot of excitement in life and want that little extra thrill, and that's just fine. But some people are living at this not quite okay level and crave something to allow them to feel alive. So Dr. Kenneth Blum discovered a genetic disorder called reward deficiency syndrome. And it's actually very complex, but it leads to low dopamine activity and a resulting lack of normal enjoyment kind of from day one. People just feel a little or a lot flat from day one and not normal until they discover a mood-altering chemical that fires dopamine, and all of a sudden we feel alive, like for the first time in our lives. Now, fortunately, we can use tyrosine and adrenal support to give us that same sense of aliveness without needing to go for these hardcore mood-altering drugs. But what's really interesting about reward deficiency syndrome, Leisha, is that it leads to the full range of addictive behavior throughout an addicted family system. So grandparents, uncles, cousins, siblings, parents, somebody may be an alcoholic, somebody may like cocaine, somebody may like cigarettes, somebody may be a compulsive overeater. There may be a gambler there or a pornography addict, and then somebody cuts. Even though these behaviors look very different, they are actually all driven by the same biochemical deficiency in the brain.
Wow.
And what's wonderful is that all of these can be addressed using amino acid therapy. So substances which deplete dopamine, but also which fire it and which give us temporary energy: caffeine, so chocolate, of course your stimulant meds like Ritalin, Adderall, Concerta, which have become street drugs, cocaine, meth, but even marijuana and opiates will fire dopamine. Even if they're firing other things as well, it's sort of like the buck stops at dopamine. I don't want to go into too much detail here, but to build, rebuild dopamine, we want to use either L-phenylalanine or L-tyrosine, which you can buy from your vitamin store. And then some of the cofactors that you need are vitamin C, all the B vitamins, and then the omega-3 fatty acids, such as fish oil or flaxseed oil, will also be very helpful in rebuilding dopamine and give you energy, drive, and alertness. Now, iron is a necessary cofactor, but should only be given if we know that iron is low. And so for all of your listeners to understand, many multivitamins out there which contain wonderful cofactors, many of them also contain iron. And men and non-menstruating women should not take in extra iron unless you know you need it, because it can do damage. So women who are having periods and are bleeding each month are losing enough blood to keep this iron in balance. But those of us who are have gone through menopause, men and teenage girls before they start their periods, absolutely do not need more than a tiny bit of extra iron.
Mm.
So a high protein diet will provide these amino acids, but so does the L-phenylalanine and the tyrosine. Generally, tyrosine comes in 500 milligrams. You want to start with a low dose and then build up slowly. With your L-phenylalanine and your tyrosine, you don't want to take it past 3 o'clock in the afternoon if you have a normal 10 or 11 o'clock bedtime, because except for a very small group of people, it will keep you awake. Its job is to build dopamine and norepinephrine. Norepinephrine is our wake up, get up and going, be alive, have energy chemical. And it comes from dopamine. And if we get too much of that at bedtime, then we're going to be wide awake rather than sleeping.
Okay.
So I want to stop here just for about 2 minutes and see if your listeners have any questions about tyrosine and dopamine.
Okay. Anybody have any questions out there they'd like to ask Christina at this time? Just type them in the put your cursor on your chat box and you can just type your question in.
We'll take 2 questions right now.
Yeah. Nothing coming up yet.
Okay, great. Well, let's move on then
Okay.
to 5-HTP and tryptophan.
There is one question. Should I?
Okay.
Yeah. Okay.
Sure.
Cindy asks, neuroscience does testing for neurotransmitter balance. Do you use this type of testing?
There's a controversy out there in the amino acid and neurotransmitter world about whether urinary neurotransmitter testing is accurate enough to use to dose amino acid therapy. Some people say yes, some people say no, some people say that you need 2 to 3 samples over a couple months period of the urinary testing to determine whether or not the amino acids are actually working. I'm of the school that says we don't need to spend the money on the urinary testing because we actually know what the deficiency symptoms are. And we have an assessment tool, which is actually on my website, that we use to really identify these deficiency symptoms in each of the neurotransmitter systems. This was developed by Julia Ross and has been correlated with brainstem levels of neurotransmitters, and so is actually considered, and I have found, to be very, very accurate. And then we also use the same chart over time as we watch the numbers go down to help us determine whether or not the amino acids are actually working.
This is the questionnaire that you're talking about for the neurotransmitters, yes. Right? Yeah, it's a very extensive questionnaire.
Very extensive and very, very useful, and I found it to be accurate about 80% of the time.
Okay. So the neurotransmitter, and we did do that in our office, have in the past. It's a saliva and urine test. But then there are also some people that I don't know if doing, a comprehensive blood panel, not just the normal things, but, looking at adrenal and looking at proper thyroid function and hormones and all of those things. It's also, I think, would be beneficial. If people want to get the numbers and look at them.
Well, exactly. And you can do platelet testing of neurotransmitter levels, but that gets expensive as well. The reason we're not sure about the urinary tests is because we don't think it accurately reflects what's happening in the brain versus the entire immune system.
Mm-hmm. Okay.
And that's why we prefer using the questionnaire. Yeah. In regard to all the other testing, it's what I said, like using the nutrients, good diet, the amino acids, and the cofactors resolve mood and addiction issues about 80% of the time. That other 20% is when there are other issues going on, digestive issues, hormone issues, toxicity, inflammation, etc. And then you really need to look under the hood and find out what's driving things. Right. And we can do that using all these other laboratory tests.
Gotcha. Okay. And Cindy just asked if there's a brand that you recommend, because you had said just get them from your local grocery store. But
what I look for when I'm buying amino acids is that they're free form and that there's no filler. They're capsules rather than tablets, and nothing else in the capsule but the amino acid. There's several good brands, but they're sourced pretty much all from the same place. So just as long as there's not anything else added and it's a reputable company, there are a number of good companies out there. Now is just fine. Solaray, Country Life, Jarrow, our Doctor's Best are all very fine choices.
Okay. And that was Now, N-O-W, right?
Yes.
Yeah, okay. There's one other question. Do you want to answer that now or hold it?
Sure, we can answer it.
Okay. Diane asks, you may be discussing this later, but if not, can amino acids be used to help the brain recover from concussion, anesthesia, or other brain injury? If so, which amino acids would help these issues the most?
That's a way too complicated question, unfortunately, to address in this seminar, partly because the issue is not so much depleted neurotransmitters as much as brain inflammation. And yes, we can use nutrients to reduce inflammation in the brain, but we would be using the amino acids secondarily, if that makes sense.
Okay, yes, okay.
Yeah. Okay.
We will be providing Christina's contact information, Diane, if it may be something you want to reach out to her on a individual basis. Okay.
So this lovely picture here is a picture of the serotonin molecule itself. Isn't that beautiful?
That's beautiful, yes.
And 5-HTP and tryptophan are the amino acids, which are the precursors to serotonin, which supports mellow moods and sleep. So the central nervous system functions of serotonin are multitudinous. There are lots of them. But in terms of mood regulation, it's what gives us a positive outlook, emotional stability, self-confidence, emotional flexibility, and a sense of humor. But it also helps regulate pain, appetite, and the sleep-wake cycle, and it's very sensitive to changes in light, weather, and temperature. Symptoms of low serotonin, therefore, are an anxious, agitated depression, tearfulness, social anxiety and low self-esteem, panic attacks and phobias, worry, rumination, obsessive thinking, all the way up to like the obsessive behaviors of OCD. irritability, rage, violence, and then a lot of other things. Chronic pain, sugar and carbohydrate craving, bulimia, afternoon and evening cravings, seasonal affective disorder, hyperactivity, PMS because serotonin drops as estrogen drops, and sleep issues. Now, but it's a very specific type of sleep issue. So it's trouble falling asleep or frequent waking due to obsessive thoughts and obsessive worry. Not just because your muscles are tight or because you feel wide awake. Those are other things. This is you lie down to go to sleep and you worry about everything you said that day that was wrong, and you worry about the meeting with your boss tomorrow, and you're wondering if you're going to have enough money at the end of the month to pay your bills, and. Okay, all of us have been there occasionally,
yes,
right?
A lot of people.
But it's the person who's there every night who has low serotonin.
Right.
And taking tryptophan at bedtime can work within 20 minutes and help your brain settle down, and you get to sleep very, very, very nicely. So some of the serotonin firing and depleting addictions include alcohol, ecstasy, sugar and starches, marijuana, and of course your SSRI drugs like Prozac, Zoloft, Lexapro, etc. Now, many doctors do not tell their patients that these medications are actually addictive, meaning that over time you may need more and more to get the same effect. And if you stop them abruptly, you will go into very serious withdrawal symptoms.
From the SSRIs.
From the SSRIs.
Yes.
Even leaving them behind when you go on vacation, because you think you're going to be relaxed on vacation and you won't need them, will precipitate withdrawal symptoms.
Wow.
So there's a reason why happy hour is as the sun goes down, because serotonin starts dropping in the late afternoon and evening, and in the winter. As I said, it's very light sensitive. So as the sun drops and it becomes darker, our serotonin often drops. And so we will, sort of unconsciously look for substances or behaviors that will fire and raise serotonin levels.
So can I just ask you a question about that? So
Absolutely.
It would be normal then for the serotonin to be dropping at that hour, right? Is that what you're saying?
Yes.
So
yes.
If it's normal for it to be dropping, why would that precipitate people to want to raise it again? Is there a way for us just to come down with the serotonin if we're in balance?
So that's a really, really good question. And I think one of the reasons why it's lowering is because it's turning into melatonin.
Okay.
And helping us get sleepy and relaxed and ready to go to sleep. Because melatonin, which comes from serotonin, is our sleep hormone. But if we have been low to begin with, and then it drops even more, then we're in trouble.
Right.
And that's where people start getting into different types of addictive behaviors.
Right. Okay, makes sense.
There is a relationship between gut inflammation and low serotonin levels. And in our modern world, there is a lot of gut inflammation. And so we think that there's an epidemic of low serotonin depression going on. And so we're starting out of balance.
But it's really the fact that people's guts are not working properly to create the serotonin that they need for their brain.
Exactly. Or it's It's a little more complicated than that,
Right.
but the end result is that there's not enough serotonin for the brain.
Mm-hmm.
And so we end up with this anxious, agitated depression.
Yeah.
So tryptophan, which we find in food, turns into 5-HTP, which we generally don't find in food, turns into serotonin, turns into melatonin in the presence of vitamins and minerals. Some of you may have heard in 1986 that tryptophan was taken off the market by the FDA. That's true. A factory in Japan had released several bad batches of tryptophan, which killed some people and injured others. It turns out that they had simplified their filtering system and thus releasing some impure tryptophan onto the market. Well, the FDA rightly jumped on this and wanted to find out what was going on and withdrew it from the market. The question many of us have, however, is that it was withdrawn from the market the same week that Prozac, which is the first SSRI, selective serotonin reuptake inhibitor, was released onto the market. Now, I've heard, I don't know whether it's true or not, but I've heard that the Prozac manufacturers were having trouble finding doctors to test the Prozac because they'd been using tryptophan for years with their patients, and they were very happy with the tryptophan because it didn't have any side effects.
Mm-hmm.
And they didn't see a need for a new medication. But of course, once it was withdrawn from the market, then they had no choice but to go onto the Prozac. Until several years later, it was discovered that a plant from South Africa called Griffonia contained significant amounts of 5-HTP. So the, herbal and vitamin manufacturers jumped on this one, released 5-HTP onto the market. It worked beautifully. And so the FDA then got around to letting tryptophan be sold over the counter again. So that's that. Very interesting.
Very interesting. Yeah, how
background.
Coincidental. Yeah.
Now, to create serotonin, we need the cofactors B6, C, magnesium, some others as well. It's degraded by oxidation in the body and by certain enzymes, one of which is overproduced by aging and inflammation. So the more inflamed you are and the older we get, the less serotonin we are going to be producing and utilizing. So this is where it can be very, very useful to then bring in the precursors. You always want to start with a low trial dose with 5-HTP, 50 to 100 milligrams at a time. You can go higher if needed. L-tryptophan can be sedating, so it's often better used at bedtime. 5-HTP during the day. Some people do just fine with either. Some people do better with one or the other. Again, I'm just kind of giving you all a very brief introduction to
great overview.
Now, the biggest precaution here is that you absolutely do not want to use 5-HTP or tryptophan if you are on more than one SSRI. And that's actually going to include migraine medications because they also work on serotonin. You can use it on one, if you can use a precursor along with one SSRI, but this is where we highly recommend that you work with a practitioner who knows what they're doing. Right. And then you generally want to avoid the use of any amino acids if you have cancer, unless you're working with somebody with a lot of experience and working together with your doctor.
What is an MAO inhibitor?
This is an old class of medication that's not being really used very much anymore.
Okay.
I think trileptal is one of the medications, and I'm really not remembering because I just don't run across it.
Okay.
You'll know if you're on an MAO inhibitor.
Okay.
Okay, I'm going to move on here and then we'll come back around for questions.
Okay.
So GABA gives us calmness and relaxation. And this is a beautiful photograph of the GABA molecule itself, electron microscope. So GABA is the brain's primary inhibitory agent. It opposes glutamate, which is our primary activating agent, and it moderates other neurotransmitters. So it does a lot of things in the brain. But the ability to slow down and relax requires adequate GABA. The ability to cope with stress without getting overwhelmed and to sort of flow through things requires GABA. And it's our primary natural anticonvulsant. So seizure disorders, other convulsant disorders, tremor disorders are often, I don't know about always, but often a sign of not enough GABA.
Really? That's interesting.
Yeah. Now, it allows our muscles to relax, to give us a restful sleep, allows us to be calm, stable, and committed, resilient, organized, and able to complete tasks, and it allows us to filter out distracting stimulus. So people who have low GABA include people with the highly sensitive personality type, where you just feel bombarded by sensory signals all the time and you don't have the ability to filter them out. Children and adults with ADHD, where there's just all the stimulus coming in and it's very distracting and you can't filter it out. But where you also feel stressed and anxious and overwhelmed, tight muscles, trouble sleeping because your body is tight and it hurts and you're restless and you can't relax. Fatigued but wired, often digestive issues such as IBS, and then chronic use of alcohol, marijuana, and benzodiazepine drugs for relaxation.
Would Parkinson's fall into that? Parkinson's tremors? No.
It's interesting because Parkinson's is actually related to the dopamine system malfunctioning.
Okay.
But that's a really good question, and it's possible actually that GABA can help with Parkinson's, but I've not studied that, so I cannot tell you.
Okay.
The substances with fire GABA, some of these you'll see fire across the board. Sugar, alcohol, and marijuana, and tobacco, fire across the board. Sort of whatever you need, they'll come in to, fill that gap. And then the benzodiazepine drugs, which are highly addictive, Ativan, Xanax, and Valium. There's some others as well. Mm-hmm. So you can buy GABA itself over the counter. We want to start low. Sometimes people can have a paradoxical effect in response to high GABA. So we don't want to go over 500 milligrams at first, unless you actually know you can tolerate that. So we start with 100 milligrams, build slowly, but you can take it up to 6 times a day if needed. You can
Is that
take
something you could open up? Is that a capsule you could open up if you're having your...
Exactly. Mm-hmm. Just dump it under your tongue or mix it in with a little bit of water. I like using a GABA formula. There's several on the market. There's a couple of chewable ones, which are really nice. They taste good. And then there's a couple of other combinations that, again, work within 20 minutes just to take the edge off. One of my favorite is True Calm, which is developed by Julia Ross. And I find that for my clients with a lot of social anxiety, giving them a True Calm along with 100 milligrams of 5-HTP before a date, before a job interview, before a presentation, the things that most people want to sort of duck for cover before, can take that edge off and really make people relax and able to do a good job.
That's so empowering, because especially, let's just take social anxiety. I think that people would think that's almost a character defect. They don't realize that it's maybe a GABA, because you're low in GABA.
Because you're low in GABA or low in serotonin.
Yeah, all of these things, you think that it's in your head. Like, why am I depressed? Why can't I just get over it? Why am I so sensitive? Why do I have social anxiety? Well, it's not a matter of just being in your head, or just gut it out, or be stronger. You have a chemical deficiency that's going on, that's causing. I think that's very empowering, because people with social anxiety, it's debilitating.
It is debilitating, and very often it's as simple as this. Now, just to talk about social anxiety for a minute, as I said earlier, I always start with amino acids. And so usually with social anxiety, I'll start with 5-HTP and True Calm. If that doesn't work, then I'm going to look for a deeper underlying issue. And with social anxiety, the underlying issue I'm going to be looking for is a genetic disorder called pyroluria. Which depletes the brain of zinc and B6, which are the cofactors. So if you don't have enough zinc and B6, you can take all the 5-HTP in the world, and it's not going to get to serotonin. And that's why it's not working. So we test for pyroluria, and if it's there, we give the person zinc and B6. And very often, the social anxiety will go away, or the 5-HTP will then start working.
How do you test for pyroluria?
Pyroluria is a urine test. You want to test for a substance called a cryptopyrrole. So moving on, one of my favorite GABA support nutrients is called theanine, also known as sun-theanine. And it produces a calm alertness. So I'm one of these unfortunate people with attention deficit disorder. And how that affects me sometimes is that if I have too much going on for my poor little brain to handle, I feel bombarded. My anxiety turns into panic. I start spinning. I don't know where to start. I don't know what to do next. And I go in circles, and then I freeze, and then I go do something else and totally procrastinate because I'm just way too overwhelmed. Taking 100 milligrams of theanine before I have to start cleaning my kitchen or putting together a report or all of a sudden allows my to-do list to stop spinning around my head and settle down, and I can actually do and finish one thing at a time. It's very, very useful. It's also, I will use it for myself before bed if I'm revved up. If there's a lot going on before bed and my brain's spinning just because, I'm still jazzed and I can't sleep because the cortisol's running and I'm, ready to run a marathon. I will take the theanine, and within 20 minutes, it will have shut off that adrenaline and will allow me to settle down and go to sleep.
That's great.
So there's a couple of other supporting nutrients, but we don't need to go into those right now. Other than I want to talk about magnesium. Magnesium is very, very useful for people with anxiety and muscle tightness. It's also good for women with menstrual cramps and people with migraines. So the endorphins, restoring and giving comfort. Isn't that a pretty picture?
Oh, that is so beautiful. Yes.
And that's because when there's bonding, when there's hugging, when there's love, all of that builds and supports and fires our endorphins. So the endorphins create the feelings of contentment and enjoyment. They relieve pain and they create numbness when needed. So it's the person who's been in an accident and badly wounded, and they don't feel it immediately. Or when somebody in your family dies and you go numb, this is the product of the endorphins, so you can do what you need to do before the pain sets in. But they're also active when enjoying a good meal or good company, recalling a happy memory, thinking about someone or something loved. So if you just take a moment right now and do that, and you notice that warm, fuzzy feeling that comes up, that's the endorphins. Oxytocin is part of that family. Receiving a hug, enjoyable sexual activity, okay? All of this is the endorphins. Bonding. So when the endorphins are low, lack of pleasure, sensitive to pain, chronic physical and emotional pain depletes your endorphins. But then you're also more sensitive to physical and emotional pain when your endorphins are low. Tearfulness, loneliness, and grief, and possibly many of the symptoms of borderline personality disorder, which is due to a lack of bonding and connection in young childhood. So what can deplete them? Chronic stress. Again, having a very sensitive nature can be part of low endorphins. Chronic emotional or physical pain, lack of protein, low estrogen. Brain injury is a big one here. So in answer to the question about brain injury, it is important to support your endorphins. So to restore the endorphins, it requires a high protein diet. But there are amino acid formulas that will help support these as well. I like Total Amino Solution by Janessa and synaptamine. But you can also use D-phenylalanine to raise the synapse levels of the endorphins. So you know how I talked earlier about L-phenylalanine, which turns into tyrosine and then dopamine? Well, D-phenylalanine is its mirror image. It's synthetic, and it was developed to lower the amount of morphine used in post-surgical patients. So it actually, in many people, relieves pain. It's not as strong as an opiate, but it can absolutely take the edge off things.
Really? Okay.
Now, the FDA doesn't quite know what to do with it, so you can buy it online with no problem. But over the counter, you can only buy it when it's mixed with the L-phenylalanine, called DLPA. So DLPA is a combination of the D-phenylalanine and L-phenylalanine. So it helps reduce pain and gives comfort, can help with grieving, can help with loneliness. But because the L-phenylalanine is there, it also gives you a mood boost. So it's a really nice combination. Yeah. And many of my clients and students just adore it. You know, 2 to 3 times a day.
Yeah.
It's a very, very useful supplement. So I want to talk just briefly about opiate addiction, because we use the D-phenylalanine to help withdraw people off their opiates. And we can actually do it very effectively. I mean, so that we can definitely help people withdraw from heroin, oxycodone, etc., with less withdrawal symptoms than otherwise. So, Leisha, I just want to ask you right now, it's shortly after 8 o'clock, so I can talk about this very briefly, or we can stop right here. What would you like me to do?
Well, there's two questions. Why don't we answer those, and then
Okay.
if you have the time, if you could touch on this briefly, because I think it is so important. But let's get these questions answered, and
Okay.
then in case these folks have to go. So, Erin asks, can these symptoms of low serotonin, it was when you were talking about low serotonin, be caused by psychological issues, or is it all traced back to low serotonin levels?
Okay, that's a really wonderful question, because the answer is both and. Because when we are under extreme emotional stress and trauma, or have had developmental trauma in young childhood, that in itself has been shown to deplete serotonin levels. Stress depletes serotonin levels. So what I do with my clients, because I'm also a psychotherapist, so what I do with my clients who truly have emotional distress and emotional and psychological issues is I want to help support their brain. I want to support their serotonin levels while we are doing the healing psychotherapeutic work. Sometimes it's just biochemistry, and once you get those amino acids in there, people don't need therapy anymore. I've had that happen. But more often it's a combination that people both need to support their neurotransmitters and they need to do their therapy work. But what I found is that once I help my clients have a well-fed, well-functioning, balanced brain, they are much more able to engage in the healing work than they were before.
Right. Much more able to move through any issues that they may have and
Exactly.
move on to wellness.
Exactly.
Okay.
Yeah.
Okay. Cindy asks, what do you think our magnesium level should be?
Ooh. I don't have that in my head, Cindy. I'm sorry about that. But I do know that 400 to 800 milligrams of magnesium a day. I recommend magnesium glycinate because it's less likely to cause diarrhea. Can be very helpful. A lot of the studies I've read show that in modern American society, most people are low in magnesium. I suspect that's just because of the low level of minerals in our fruits and veggies. I don't know that for certain, but that's my suspicion. But I've read in several different places that when people are tested, very often magnesium comes up low.
Okay, could you just repeat that again? Which magnesium did you say,
Magnesium
Christina?
glycinate.
Glycinate. Okay. Erin asks, can GABA be used for an acute anxiety/panic attack?
Yes.
Okay, so then that's where you would maybe open up a capsule, put it under the tongue, or get one of the chewables.
Yes, and I would start using GABA before your panic attack to find out how much of it you can tolerate at one time. Some people cannot tolerate any more than 500 milligrams at a time. Then I've had a very anxious client who took 3,000.
Wow.
And that's what allowed her to, she was agoraphobic. 3,000 milligrams of GABA at a time is what allowed her to leave her house and babysit her grandsons. Other people, you give them 750 milligrams of GABA, which is very often how it's sold, and it gives people panic attacks at that dose. So you have to start low and find out what works best for your own body and brain. Very often taking the 5-HTP with GABA will help offset a panic attack. But panic attacks can be due to low blood sugar.
Mm.
I had a client come, she sat down on the sofa, looked at me and said, "You're number 8. I said, "Number 8 what?"
Mm.
She said, "Well, I've had daily panic attacks for 10 years. I've been to 4 psychiatrists who put me on medication that didn't work and made me feel weird. I've been to 3 psychotherapists who were all very helpful with life, but it didn't make a difference to the panic attacks. So you're number 8.
Wow.
I thought to myself, oops. But I asked a question nobody else had asked. I asked, well, what time of day are your panic attacks? She said, well, upon arising and then between 4 and 5 o'clock in the afternoon. I said, oh, that's low blood sugar. Turned out that she would eat an early dinner. She usually skipped lunch. She didn't eat well anyway when she did eat. And so I told her what to do, made an appointment for the next week. She calls me 5 days later, cancels the appointment, says, "Thank you so much. I have not had one panic attack for the first time in 10 years since I left your office."
That's amazing.
Not amazing?
Yes, that's amazing. Yeah. I mean, that's what I mean. That's life-changing. One panic attack is enough for me in my lifetime, let alone having them for 10 years is insane. Wow.
Exactly.
Can you take a couple more questions, sure, Christina? I don't want to abuse your time here. So, okay, Deb says, I've had insomnia since menopause 3 years ago. I fall asleep but wake up around 3 a.m. and cannot return to sleep. Doesn't seem like serotonin. I've tried GABA, progesterone, other sleep aids. Any suggestions for which neurotransmitter I'm deficient in?
So it depends upon your symptoms. If you wake up at 3 o'clock and you're like wide awake and ready and raring to go, even though you're still tired, that's usually adrenaline caused by low blood sugar. And if you eat something, maybe a little bit of plain yogurt with some applesauce or some nuts in it, some people will do half a banana with some unsweetened peanut butter, just a little bit of protein and complex carbohydrate. Within 10 minutes, you're likely to be fast asleep again. If you're waking up with that obsessive worry and thinking, then it probably is low serotonin, and taking 500 milligrams of tryptophan at that time would help, or 1,000 to 1,500 before bed might help as well.
Okay. Marianne asks, should you detox your body prior to starting these supplements? Have you heard of Plexus? I don't know if that's a brand.
I have not heard of Plexus, and generally nobody detoxes before starting on these supplements.
Okay. Amy asks, is it safe to take amino acids while pregnant/breastfeeding?
So that's the $1 million question right there. Mm-hmm. We know that it's not safe to take SSRIs and benzos for anxiety disorders while pregnant and breastfeeding. There's very clear research that shows that can harm baby. The problem with amino acids is that we don't have the research. The women I know, including myself, who've taken amino acids during pregnancy, our babies have turned out just fine. It's logical that taking amino acids during pregnancy and breastfeeding is safe because it's purified food. We also know that anxiety disorders themselves are not good for baby. So this is a matter of really looking at all your options, and if you really truly have an anxiety disorder, it could be very useful for you to take low dose tryptophan or 5-HTP while pregnant, because the theory is that your body actually needs it because you're having deficiency symptoms. Now, you can do tests for amino acid levels and see if your tryptophan is low. The problem with that is people have different needs. The normal range is compared to a database, and you might not be one of those people who has the same needs that, the rest of your peers do. So it's a very tricky question, but I know for myself personally, I would use them.
Okay, thank you for that. Cindy asked, do you take out-of-town patients by Skype?
I do, yes.
And we'll be providing that Christina's contact information. One last question from Erin. How much protein is recommended for females?
Generally, a minimum of 40 to 60 grams of protein a day. The more petite you are, you can get by with less. If you're very active, if you're bodybuilding, if you're working out a lot, if you have a larger build, then you need to be in the higher end of that. Now, many nutritional professionals I've talked to think that scale in and of itself is way too low, which is why I'm saying you need a minimum of 40 to 60 grams of protein.
Okay. All right. And Erica says, thank you. So Christina, it is 20 after 8 now, and I guess
so we should stop.
Yeah, we should stop. And this part, though, why such an opiate epidemic in this country, will be on your PowerPoint presentation, and people will be able to at least look over the slides.
Yes.
If they look it up. Well, you've given us so much to think about. This information that you're presented is just so powerful and so important, and I hope everybody listening shares it with family members and takes this information and uses it, because we do have an epidemic, not just of opiates, but of anger and upset and stress in our country. So you've given us some wonderful tools here, and it's hopeful, that these things are within our grasp to control. And so I thank you very much for the time and for going over time, and for the wonderful presentation you put together for us.
You're very welcome. Thank you.
Okay, so for next month, folks, our webinar will be on September 27th from 7 to 8. Our presenter will be Elsie Kearns, wellness educator, and her topic will be the intuitive heart, creating heart-centered coherence. We also have an upcoming class. It's learning how to run the bars, which is part of Access Consciousness. That's going to be on Saturday, October 21st from 9:30 to 5. There's information about that on our website. I've got Christina's contact information here, her email, and this will all be available on our website, and Christina's going to add a slide with her contact information if you wish to contact her. Email Christina Veselak @gmail.com. Phone number 303-888-9617. Websites addictionnutritionacademy.com and Feed Your Brain First. And don't forget, Christina did mention that upcoming Salt Lake City weekend intensive that maybe some of you folks would like to partake in. So again, thank you all for joining us. Thank you for your questions. Christina, thank you for the information, and I wish everybody a good night.